Hello. Hello, good afternoon, ma'am.
I'm not able to hear. Am I audible? Am I audible?
Hello. Now are you able to hear?
Now I'm able to hear you, sir.
Yeah, fine. Thank you, ma'am.
Sir, am I audible?
Yes. Perfect.
Okay.
Ma'am, can we start? Can we start, ma'am?
Yeah, yes.
So, a very good afternoon to students and dear Madam Dr. Krupa Angelin. So, before we move to the lecture, let me take the opportunity to introduce Dr. Krupa Angelin, ma'am. She's a nursing superintendent from Mahatma Gandhi Medical College and Research Institute, Puducherry. Previously, it was known as Pondicherry. And she had her master's MSc in medical surgical nursing and PhD nursing from Annamalai University. And she has a vast experience in professionally in different capacities, like being a staff nurse and assistant lecturer, professor in Kasturba Nursing College, and presently she is the nursing superintendent as well as professor. She have dual role in the hospital and the college. To highlight her career, she is the lead team for NABH Nursing Excellence, and she had various membership in associations, and she is the examiner for various university, and she got the award for best faculty from the Sri Balaji Vidyapith University, and she had done various projects and research on tuberculosis and other few copyrights and patent also on her credit. So, ma'am, we are so fortunate enough to call you as an external lecturer for our students. As you know, these are second semester students, and the topic is today on a nursing informatics subject, and she will deal with the unit number 4. And it's a kind request to students, please attend the class very well. And in spite of her busy schedule, she gave her time for us, and you should utilize the time. You can clarify if you have any doubt, and madam will take the class on unit number 4 on health informatics. Over to you, ma'am. Thank you.
Thank you, Mr. Chris, for this elaborate introduction. Actually, I didn't expect this elaboration. To be simple, I'm a professor, very much passionate to teach the students, okay, to do justice to whatever is given to me. Hi, dear students. Good afternoon to all. Am I audible to you all? You just can wave your hand if I'm audible. Yes, thank you. So let me share the screen. I thank Mr. Chris for giving me this opportunity to interact with you. Actually, thanks to the technology, because from this corner to this corner, we're able to connect to you, see you all. Really, I feel very happy to be connected like this and see you young minds like this. And I hope I'll be able to give you the clarity in whatever task is given to me to the maximum best possible. So shall I start my session?
Yes.
Is my screen seen?
Yes. It is visible.
Okay. Yes. Good afternoon to dear students. I think you would be familiar, at least once in a lifetime you would have visited the hospital, and since you're second, you would have gone and seen the patient records. Yes. So this patient records actually once in the previous era it was existing as paperwork, and now we are entering into an era where it's becoming electronic health records. Okay, and so the topic given to me was challenges of capturing rich patient histories in a computable form. So though this topic seems to be very much elaborate, something like jargon words, it's very simple, very simple. Like First of all, we should understand what is electronic health record. In 1992 itself, this electronic health record has started evolving. Okay, so the hybrid form of paper, electronic data was there. There was different database. There were personal computers with graphics used as monitors. There were data entry through keyboards and mouse. Okay, and they were sort of internet scanning printouts. And we were using this electronic health record only for like certain things like drug reference or to prepare a manual. Like this only we were using. Okay, this was in the 1992. But in 2020s, this electronic health records is used in primary care exam rooms by insurance companies, nursing homes, hospice, homeless population, etc. And mostly vendor of EHRs are vendors are using giving this EHRs to us, and personal health records interface with EHR. Okay, and now we are also gone into data mapping, mental health, external labs, e-prescribing, order sets. All these I'll be explaining to you what are all these things. Okay, biosurveillance, public health, increased clinical decision support, natural language processing. So, what is all these things? You can see a picture over there. Okay, before patient records were like this only. We used to have files of paper together, which includes starting from the assessment form, the admission record, assessment form of the doctor, then progress sheet of the doctors, the nurses records, and we'll have the medication chart and accessory records like intake output chart and position chart. All these things will be compiled together, and when the patient gets discharged, this all be converted into this paper form itself and stacked in the medical records room. Okay, so this was the normal thing, but now all this has been converted into a electronic health records. Okay, where you can have a natural language processing method. There's a big data is there, and EHRs has become an open source system. There are a lot of digital identities and increased EHR education, cloud computing, etc. So this is the conventional method what we had old. Okay, so all the patient who enters into the hospital was carrying this files of history, patient history, and the treatment thing in a file, case file, which will be left in the medical record section after the patient discharges. Okay, and they were maintained, written on paper and maintained in folders only, and they used to divide into different sections. Okay, and whatever new information is added, that was also added as a paper form in each of the section. But now we have started into an electronic health record, which has become ease for the patient and the healthcare people also, team also, to not carry such a cumbersome files, but just to see the records maintained in the digital base. So now coming actually into the topic, what is this electronic health records? I think you can understand what we did earlier and what are we doing now. Okay, all this paper forms is being converted into an electronic mode. Okay, a digital mode. That is what we call it as electronic health records. So what is this electronic health record? It captures and manages all the information which is collected from the patient, starting from the OPD consultation, still they become IP, and whatever claims they have to do, what are the different patient portals available, reimbursement information. Okay, from the insurance, from the payers, sometimes they will be the insurance people, isn't it? Okay, and where all in the different parts present in the patient's profile. All this data collection, cumbersome data collection, is called as electronic health record. Okay, in simple term, it is consolidation of the patient's case file into an electronic form, and it can be moved across between various healthcare partners in a wink of an eye. Okay, before it was not like this. Okay, but now in a wink of my, just by clicking one keyboard button, you can just transfer everything to another person, whomever wants to see at any part of the world. Okay, so these electronic health records have become increasingly important in healthcare, providing lots of benefits by improving patient care, increased efficiency, reduced cost. What is this improved patient care is the documenting time has reduced, so that quality time for the nurses, quality time for the patient has improved. Okay, So they need not keep always writing, jotting. So instead of that, electronic system has come where they can keep, so that the patient's care need is met by the healthcare team. Increased efficiency, where you maintain a manual record, you can erase it and rewrite, but in an electronic record can not be done. What is documented forever, and it improves the efficiency also. You have to be accurate. And reduced cost, yes, don't have cumbersome piles of paper, that cost is reduced, okay, and sending to another person, everything has come down because of the electronic health record. But still, this electronic health record software can be very complex and challenging in a healthcare organization, which is almost very much habituated to a routine practice. Okay, so when you implement an electronic health record, there are different softwares available. We use Backbone in our hospital. Okay, IOSTA Backbone is what we use. So every hospital has their own software. There are a lot of companies providing this electronic health record base to be implemented into the hospital. So when you initially start in the hospital, it's very much challenging. Okay, so to implement this, there requires a careful planning, preparation, execution to overcome the various challenges that organizations may encounter. So to define, it is a digital version of a patient's paper chart. Whatever we were maintaining a paper chart regarding the patient's history till the discharge, okay, or even if it's if the patient is the discharge summary, everything what was maintained in a paper chart is to be maintained in an electronic digital version. Okay, that is only a simple form of understanding electronic health record. What is there in this electronic health record? We have the physician clinician's reports. They are not reports, they are notes, the progress charts, what findings, what treatment they have prescribed for the patient. Okay, the laboratory investigations are there in the electronic form. The insurance companies, okay, for them it's again transferred in this electronic form itself. We need not take up a big file, take a Xerox, multiple copies of Xerox, get it attested and then carry to the insurance office. It can be done digitally, it can be sent over to them. Okay, you have the monitoring records, everything is electronic health record is there in that. Next, radiological reports have become digitalized, and hospitals, like wherever hospitals where you want to transfer the record, for example, for reference you want to transfer, for AMA you want to transfer to another hospital the patient's basic profile, so that also, and EMR, okay, in emergency medicine, whatever hospital notes present for the patient, everything is put up in the electronic health record. Okay, again, to cut short, it's a longitudinal electronic record of patient health information generated by one or more encounters in any healthcare delivery system. What is this one or more encounters? A patient comes with the abdominal pain, gets admitted into the medical OPD. So the person comes to medical OPD. From the medical OPD, his record starts documented in the electronic health record. Okay. After abdominal pain, they wanted to shift to radiology. Yes, that patient's radiological information will be there. Once his name is registered in the software, okay, in the registration process, once his name is entered, wherever he goes across the hospital, he will be given an ID number, UHID number. Okay, that will be entered into the system. So any part of the hospital he goes around for any sort of investigation, any sort of reference, he wants to get a cardiology opinion, he wants to go for a surgical opinion, anesthesia opinion, everything will be there. If you open his file in the system, electronic system, it will be there. Okay, through that only it can be processed everywhere. So wherever he goes, all the data are entered into the electronic health record. So these are real-time patient-centered records that make information available instantly and securely to authorized users. You can ask me if it is available to everybody, whether it can be misused. Yes, can be misused, but here security is that only those who have the password can access to this patient's information. Everybody cannot access into it. Thereby the document control is also being maintained. Okay, what is the EHR's vital part of healthcare? It contains patient's medical history, diagnosis, medications, treatment plans, immunization records, allergy history, anything you have to, history collection charts are kept there, radiology images that also can be stored, laboratory, right from the request till the report, test results, it is maintained in electronic health record, and also allows access to evidence-based tools that provides can to make use of decision about a patient's care, And also it is automated and streamlined provider workflows. What does it allow? Access to evidence based tool is whatever data you have there. For example, a patient comes with a fever. Okay, if you have to prescribe an antibiotic, you cannot give anything. Already the formulary is fixed in the computer. The fever paracetamol only you can click. You cannot get anything beyond that. Antibiotics, if you open a standard antibiotics, the drug only will be there. So we have certain evidence based tools also to take a clear decision. And at the same time, there are many other systems available, like the scan systems available, where the reports can be viewed. The doctor sitting 50 kilometers within the radius of the hospital, sitting at home, he can digitally see the scan report of the patient even during a midnight in the emergency ward, and tell his decision to the person on duty, telling that yes, the scan report shows that we have to take him for an emergency surgery. So the access is there. Okay. Automate and streamline provider workflow. What is automate and streamline provider workflow is, once you start entering a data of the patient, a number is being created, an identity is being created for the patient. Automatically, wherever he goes to the hospital, even if he has to get one drug, unless he uses the ID and enters into the database, he cannot get anything. So it is automated already. So it gives the process very easy and streamlined. Okay, so streamlined way, like bill will be generated, he will pay, then the medicines will be given to him in hand. Investigation, you request, send it through the electronic method, and the requisition will be sent to the lab. There in the lab, they will open the system and see the requisition. They will get the sample, process it, put the reports back into the system. So everything becomes a streamlined provider workflow. So there is no any discrepancy at all. Okay, now what is this International Classification of Diseases, or ICD? Why I am bringing this here is, whatever health records you are maintaining, it should go by the standards of the International Classification of Diseases. Okay, so this is an important set of codes that healthcare providers use to classify and code all diagnosis, symptoms, and procedures recorded with acute and ambulatory care. Okay, so the MRD section, the medical records section of the hospital, will arrange or organize the medical record of a patient record, only based on the international classifications of diseases. So right now we are following ICD-10. Now we have next version of ICD-11 is also coming into action now. Okay, but our electronic health records is following with the standards of the ICD-10 code. We have to follow these norms to tell that our patient record is quality based record. Okay, so this is one standard for us given from the to be followed by the medical records section, that they have to undergo through this international classification of these. Under this only they will code all the diagnosed symptoms, procedures recorded for the patient. Okay, so why I am talking about this is that it has certain benefits. Okay, this gives us a standard of how to maintain a record. Okay, first is quality measurement. The codes given through ICD, we are following the ICD-10, and ICD-11 is very shortly to get into practice. Okay, still it's on the pipeline. We'll get into practice very shortly. Now our electronic records will stick on to the codes given by the ICD-10. Okay, first is quality measure. What is the benefit when we follow ICD-10 is quality measurement. Okay, the codes have the potential to provide better data for evaluating and improving. So when we follow these codes, automatically we have a very good data to improve the quality of patient care. Quality measurement in the sense, you have ICD, according to the ICD, diabetes comes under a non-communicable disease. Okay, so you code all the case sheets under non-communicable disease. You will have a very good better data to evaluate for future research and anything else also. For example, from the year 2023 Jan to December, you want to take up only the diabetes mellitus, primary diabetes mellitus patients. They would have coded according to ICD-10 classification in the MRD section. So easy for you to retrieve the data and how the treatment was followed for such patients, how that can be improved further. Okay, that is it becomes a quality measurement tool. So ICD-10 classification helps you for that. Second, public health. Okay, ICD-10 codes are used globally to track health statistics and causes of death. So by this ICD-10 code, for example, you wanted to COVID we had, okay, under this COVID comes under the ICD-10 code. So how many COVID deaths had happened? Okay, so that you can be able to track and get a statistics to the give it to the government, and also you can find out the causes of death due to COVID or whether any other comorbidity. So it provides a service to the public, it helps in maintaining the public health and improving the health of the public too. Research, of course, this benefits of ICD-10 helps you in improving your research also. You can get a rich data, like how many malaria cases are there, how many dengue cases are there, what was the treatment for the dengue. If you take up a paper and start researching everything, it's very difficult. But in electronic health records with the ICD code, it's very easy to take up, because you would have arranged your records only based on the ICD-10 classification. Also, it helps in organizational monitoring and performance. Okay, so whichever comes under this ICD code 10 only, this insurance companies and healthcare providers also will help monitor your service. Okay, so this is a standard given for maintaining the records, and we are supposed to follow. Just like we have nursing ethics, isn't it? A code of ethics. Similarly, ICD-10 has a code of mechanism for the record section to follow. Okay, so this is the benefits of following this. And this electronic, not only electronic, normally an MRD section, a paper health record system also should follow. Electronic health records is still more further helps to follow and stick on to this ICD-10 coding. Okay, so it plays an important role in the ICD-10 coding process, which is a very good data for the hospital, institution, for the organization where the hospital is situated, for the whole regional area where the hospital, for the district, for the state, and for the national statistics also. They serve as primary diagnosis entry point, with the diagnosis typically captured in multiple places, and also including the problem list and as encountered diagnosis. So why is this EHR important? Okay, this effectiveness of EHR helps to automate and properly streamline, as I told you, the process for providers, and makes the healthcare workflow more efficient toward care-driven goals. I will tell you when I go to the next section how it is happening. Okay. Next, it's inevitable tool for hospital as well as private health practitioners across the world. Okay, for hospitals again, this electronic health record minimizes the time for writing. Okay, the same, it's a very good store place for documentation. This documentation can be shared across with other practitioners across the world easily in a minute's time, and you can get cross references too. So electronic health record helps as an important tool for this cross referencing also. It fosters better health outcome while reducing the cost for both the healthcare provider and the patient. Reducing the cost for the healthcare provider and the patient. Healthcare providers are we, the nurses and the doctors and the healthcare team. And the patient, how does it reduce the cost? Okay, I told you, once you document a care in this, you have to be very careful, because if there is error, for example, very simply I can tell you how it reduces the cost. You have raised a request for hemoglobin. Hemoglobin cost in a private sector will be around 50 rupees to 100 rupees. Okay, for a patient, a doctor has raised that this patient has to undergo hemoglobin test. So he would have paid 50 rupees. In case by mistake, again the doctor raises that hemoglobin, the electronic record system will give a red wink. Okay, red wink telling that again raised, or some alert will be given. Or even otherwise, what will happen when the nurse is drawing the blood sample, she will come and see the request in the computer. She will see why that is raised twice. So there comes a query. So there itself you cut down, you can clarify and cut down the. It's only a simple example I'm telling. Similarly, it fosters better health outcome. How it fosters better health outcome is when you get a multiple data, so many investigations, for example, during COVID, all the D-dimer were checked up. Okay, so based on the COVID's D-dimer values, some other better treatment will be able to tell that, okay, because so many people had the D-dimer with this drug, so why don't we switch on another drug? So for that analysis, automatically what will happen, your health outcome is going to improve in the next thing. Okay, and such errors which I told you, like lab samples raising twice, 2 drugs entered for a patient, all this will be reduced when you make it as an electronic health record. It negates the medical errors, as I told, leading to improved diagnostics and patient safety, and also contributes to higher patient engagement and facilitates enhanced coordination. Okay, so when it is in a medical records, electronic health record, multiple people can see the investigations, multiple teams, multidisciplinary, not multiple, multidisciplinary team. For example, a patient will not be seen only by the general medicine. They can get a cross reference from general surgery, DVL, from the pulmonology, etc. They all can see the patient's records, and through the records, they can improve the quality of patient care. They can take a clinical decision very easily. And as I told you, if there are some alert of the patient's values, there will be a notification given in the electronic health record system, where in the paperwork only if you see and identify you can see, but here it will give an alert. So this all can be possible only by electronic health record system. So to conclude with the benefits, it improves the patient care, increases patient participation, improved care coordination, because multidisciplinary team can see the records properly in very accessible. They need not come to the patient side. They can also see from their own office. Okay, they can give the clinical decisions, improved diagnostics and patient outcomes, and also practice efficiencies and cost savings. Okay. And again, advantages, it provides accurate, up-to-date, complete information about the patient at the point of care. Now I have to tell each and everything what is providing accurate. Okay, you as students, you would have gone to the patient side or check the vitals. Okay, sometimes the students have the tendency, when you have 10 or 15 patients where you have to do the vitals, what you normally do, sometimes the students will not check the vitals. They'll mark it 98.6 degree Fahrenheit for all 5 cases and go off. Okay. Then later, when some of your faculty comes and finds out, what you will do, you can come, keep a whitener or erase it, change the document, and later when the faculty comes, you get an information from another ward. Okay, faculty is coming for rounds. Okay, we will see that you are doing, she's checking the vital sign chart and all. So from this what the student will do, she'll try to erase it or make some manipulation, correct it before the faculty comes. Okay, but is this possible in electronic record? Never. Okay, once you enter 98.6, you cannot change the data. So what you will do, you will be very careful that you will be putting only the accurate informations. Okay, what if not you're not going to do the accurate information? Yes, you can also forge simply telling that I will mark the vitals as 90 points without checking. But when there is another vitals correlating with this, that shows 100 degree, this shows 98.6, automatically you will be caught. Okay, you cannot come and change the data later. So that wise it is very accurate, up to date. Then and there you have to enter. Okay, for example, today's morning shift, you have to enter the nursing notes. Once you submit, only can go open to the next shift notes itself. Otherwise, you cannot enter. So up to date, then and there you have to document whatever you do. Complete information about the patient at the point of care. Today, if the date is today 21, the patient is admitted on 18th. From 18th till 21, whatever data you want, you can see in the electronic health record. Okay, so all informations will be there. Okay, because only then it can go to the next. Next, enabling a quick access to patient records for more coordinated efficient care. That's what I told you. If you want a patient in the medical ward, okay, you want a cross opinion from the surgeon or from the cardiology, the access to this patient records is available even in the cardiology OPD. Cardiologist can see his record by putting his using the password, checking the patient's ID number. He can open and see what were the record, then he can coordinate the care also from there itself. It's not necessary they have to pass the case sheets across. Securely sharing electronic information with patient and clinicians. I told you here there is a document control. What is document control? When you have a paper record, you kept a patient record on the nurse station in, for example, in the medical ward. Some of the nursing students near the nurse station, they were having some discussion or they did some recording work. When they took their file, they took another patient's file also and went off. Okay, so what will happen? The document will become missed, isn't it? Or what you can do, if you want to share the patient's information from one ward, you can take the paper, share the information to another person. So the document control will not be under your control or the nurse in charge's control in the paper. She has to take meticulous steps to keep it under control. Of course, they will do, but they have to be very careful amidst so many works in the world. But when you do an electronic information, there is a document control, because that electronic information of a patient, Mr. Ram, okay, you want to see, Mr. Ram's thing will be viewed only by the ward in charge who has a password, or the doctor who's treating the person. If anybody else has to see, this doctor have to give the password to open this thing and see in their desktop. Okay, so thereby sharing is very, very confidential. You cannot just like this share the electronic information with the patients. It is very secured. Okay, the data is very much secured. Next, helping providers more effectively diagnose and reduce medical errors. I think I've already told you the example. Improving patient and provider interaction and communication, as well as healthcare convenience. Okay, so patient and provider interaction. What is patient provider interaction? Every day the doctor, based on this record itself, can explain to the patient what has happened, communication, everything. And also it's very much convenient for the healthcare team also to go about with the patient's treatment and the medications and the follow-up. Enabling safer, more reliable prescribing. Yes, here you cannot make a prescription error. Commonly the problem with the medication error was prescription, doctor's handwriting which is not legible. Okay, there was a lot of prescription errors because the scribbling handwriting where the nurse will not be able to read, the pharmacist will not be able to read it properly. You would have given a wrong drug. But when you go with the electronic system, everything is already fed into the formulary, hospital formulary. Formulary means what? All the drugs available in the hospital formulary, pharmacy will be typed and fed into the system. If you want to give an antibiotic, okay, for example, you wanted to give amoxicillin, right? When you type AMOX itself, automatically it will come as amoxicillin with the correct dose available in the hospital. Okay, that only is there in the hospital pharmacy system also. So there is no any prescription error, okay, because the spelling error will not be wrong. Already it is transcribed in the system. Next, helping promote legible, complete documentation, accurate, streamlined coding and billing. Wherever you go, there is no any handwriting problem at all. Okay, so everything feeded in the system already. Only you have to go and select it. For example, billing amount and all is fixed. Okay, you cannot manipulate. You want to draw. For example, a billing manager want to charge extra from you, cannot happen, because already for blood sample 100 rupees is fixed. Okay, so that amount only he can charge from the patient. Okay, so it is very helpful for streamlining coding and billing, and this coding is coding the case sheets. It's very easy. According to ICD-10, you classify that diabetes means D1. So all the patients pertaining to diagnosis of diabetes will be falling in the D1 coding system. Enhancing privacy and security of patient data. It cannot be shared by everybody. The privacy of the data is maintained. Security of the patient data is also maintained. Why we need to have this privacy and security is, example, you have a patient with HIV. When you keep a paper record, what you will do normally, we will write in the front of the case sheet HIV positive in red color. Okay, can we discriminate a HIV patient like that? No. Okay, though there are systems to tell that you should not do, but still we people may tend to do it because we are scared of the bloodborne infection, where we may transmit the infection. Okay, so such sort of privacy informations in the electronic health record system will not be provided to everybody. Okay, HIV also will be only a very small coding will be there. Okay, it will not be branded in a red color so that everybody says, oh, this is HIV patient. They cannot see it in the electronic health record. Okay, and helping providers improve productivity and work-life balance. Yes, instead of writing pages upon pages, you have more productive work to the patient side, where you can go to the patient bedside, talk to the patient. Okay, and it also reduces your stress and your work-life balance. Why? Because when you make lots of documents writing, because of workload in the ward, your home workload, everything, you tend to make errors, and every day you'll have the problem of making errors, some seniors coming and shouting at you, all these things. When it's electronic, automatic, your time is being saved, so your productivity is increasing, so you have less stress and you can balance your work life well. Enabling providers to improve efficiency and meet their business goals. Yes, how providers can improve efficiency and meet their business goals? Example, electronic health records has all the data. So, for example, a director of the hospital can sit in the system, check how many turnover has been done by this patient's payment. Okay. So, if they have the business code, it's easy to track, to get the data and analyze last year's cost, how much, this year, how much it was. Reducing cost through decreased paperwork. Lot of paperwork is minimized. Okay, paper cost also high, isn't it? So that paperwork is minimized. Improved patient safety also, because I think the COVID has given you a good lesson, like even touching the patient's documents, COVID positive patient's documents, they have to be following safety precaution. They have to put in a safe double lock cover and then only keep it in the MRD. But this electronic health records will not have such threat. So there is a safety. And MRD records, paper records, you have to see that if you are keeping it in the record section, what do you have to do? You have to see that there is no ants, there is no insect, there is no pest around, which can rat bites in the medical record section, etc. But in an electronic record, that is not there. Document is very safe. There are different, very higher capacity drives are there. We can store all these records. Reduce duplication of testing and improve health. So this is all about from the patient history, what all you are doing till the discharge. Of course, I think you know, right from the entry, first we make a admission record. Okay. So in the system, the patient's basic profile information will be collected in the registration counter. Once it is automated into the system, entered in the system, you write there, this patient has come for chief complaints column will be there. You write the complaints and then you refer the patient to the medicine OPD or medicine ward. From after that, whatever follow-up, patient doctor's notes will be incorporated into the HIM, that is Hospital Information System. This is called as Hospital Information System. So day to day, whatever they do for the patient, right from the assessment, physician's progress note, what investigations they are raising day by day. First day they want to do a hemoglobin, second day they want to do a CBC, and the CBC wanted to, for example, the dengue patient, they have to repeat the platelet every alternative day. All those requests will be only in the electronic record. They'll open the system, they'll put the patient's name and the ID number, they will raise a request that platelet to be done. Since our sister will see the request form, she will see the ID number, she will take the sticker, barcode sticker will be taken after the entry of the patient's name in the request form. That sticker will be put up in the sample, they will be sent to the lab. Then the lab will process seeing the request in their system in the lab, and then they will put the results into the system. That results will be seen in the ward by the doctor and the nurse, and for that the treatment also will be done. So like this, day 1, day 2, like this, medications will be entered from the pharmacy. Seeing the request of the medication, they will issue the medications. Okay, and that will be taken by the nurse and given to the patient. She will also see the medication record in the system only and give the medication to the patients. Prescription, everything is checked there. So day 1, day 2, this like this till the discharge, whatever patient histories, everything is automated into the electronic health record. So this is all about electronic health record, right, starting from patient histories till the discharge of the patient. Discharge summary also, what they do, they type the summary. For summary also, template will be there in the electronic health record. Patient name, diagnosis, a space for typing the summary, then medication, a space for entering the medication. After doing everything, they have to give a digital signature of the doctor. The digital signature of the doctor also, only authorized person can give the digital sign. So they'll place the digital sign. Afterwards, what happens? The patient is getting discharged, but they have to take a copy. That alone, they'll give it as a hard copy if the patient requires. Or else a soft copy can be sent through an app to the through an SMS link or through email. It will be sent. But normally, in our hospital, they give the discharge summary in a paper form because patient wants it. So what they will do, they take this discharge summary. Once the patient bill is paid, they give the summary after the bill is paid to the patient hand, and the nurse will explain what all is present in the summary and the medication and the follow-up. Okay, so this all happens only through the electronic record system. Patient need not carry anything up and down, right? Okay, everything is there in the system. When the patient comes again for a review, he can use the same ID. If he tells his name, his ID will be opened up. Okay, and from that he can follow up if he wants a readmission. The same ID will be continued. Only his number alone will, one number alone will be changed. Okay, so he can continue with that as a review patient. Or if he wants again a new record to be created, again a new records also can be created with a different number. Okay, so this is, I think you're clear with the first part. What are the challenges in this? There is lot of challenges in implementing an electronic health record system. Okay, because as second year students, when I tell it may be a little bit very difficult, but when you come to practice where you are already trained in writing and maintaining records, sending requisitions in paper to blood bank, sending requisitions to lab in paper, now automatically do everything in electronic system. If I say how difficult it is, yes, it's very difficult. So how did we go about with this challenge in our hospital is the first core team which was selected to be trained were the nurses. Okay, the nurses were trained in a series of classes and demonstrations to implement this electronic health record system. Once they got proficiently well skilled in this, they started executing, followed by the doctor's training, and then followed by the other support service people training. Okay, so it's actually a very great challenge to implement it, because there's a lot of resistance, isn't it? Many people will tell, I'm not techno savvy, I'm not used to computer. So all this training has to happen. It cannot happen in a day. It takes a series of months to get trained, and even after implementing, there'll be lots of difficulties, errors, etc. That all has to be analyzed, rectified. Then only can tell that the system is in place. Being aware of this EHR challenge in advance, and sometimes how can you meet up the challenge before, if in advance you're knowing what the challenge is, it will help the providers to avoid unnecessary data sharing. Okay, that is another challenge. Okay, sometimes I told you only the authorized person can use their ID and open the patient data to see the patient's information. Okay, what happens if that person gives his authorized password to another person? There will be a unnecessary transmission of data that is there. Okay, for example, you are posted in a medicine ward, right? You have an ID of maybe 5554. Okay, what do? Instead of you raising the request or whatever, you may sometimes feel tired or whatever it is, you will tell the intern doctor posted on what, see, you use my ID and you see the report like that. Automatically, the intern will use your password everywhere. So what will happen? He can raise extra prescriptions using your ID. Okay, though it can be stopped, but your name is going there, right? So that sort of challenges are also there. Okay, so this challenges starts from technical issues. Sometimes, as you tell, viruses not only into our body, into the system also. Okay, there can be malware functioning. There can be sometimes hanging of systems where the data for sometimes will not be able to access at all. Sometimes power shutdown. So all these times, what are you going to do? Such sorts of technical issues also will be there. Along with it, whether how good they are adopting the technical issues. Okay, that also there. Whether we are able to adapt it faster and implement it faster, and whether you are following the regulations of medical records system. That also is very much a challenge. Okay, understanding the challenge of EHR implements crucial for organization to develop a comprehensive plan and successfully integrate which software they want to integrate into the operation. If there are any problems with their software, how they are going to manage, everything has to be well planned. And once you plan and start training your people, it is easy to implement this. Okay, and once one set of whole organizational people start using electronic system, then they can teach their followers also very easily, and it's actually lots of time saving is there and improves the quality of patient care very well. What are the other challenges? Cost of implementation. This cost software, what we have to buy and implement. You first of all, the cost of implementation is, how is it possible? You have to have a computer in all the wards, and bigger wards, one computer will not be enough. Okay, you should have 2 or 3 systems based on the number of patients. For example, if it's 100 patients, minimum 2 systems you have to have. All OPD should have a system. Okay, all this, in all these systems, the software has to be incorporated, has to be put. The software value of the software amount is very high. Okay, for 1 year contract they will give the software, 2 years like that. When you increase your the cost of software installing itself is more. The cost of procuring lot of systems and the cost of training, again, that is also more. So the cost of implementation is very high. That is one challenge. But if you want to have a quality, definitely then you have to take up the cost. Staff resistance. I told you there was a lot of staff resistance even in our hospital. Most of them were diploma holders who were not having the knowledge to computer at all. But now they are the one who are excelling everything. All goes with the attitude. Okay, they had the attitude. Yes, let me also learn, and automatically now the era has become a digi era, a technological era where everybody has to learn, if not even for the work, at least for the kids to help them out in their studies, isn't it? The COVID has made everybody as techno savvy now. So there was a staff resistance. There will be a staff resistance. I don't know. I don't know how to operate. I may forget my password. All these things will come. But if you have the attitude to learn something new, definitely you can overcome this resistance. Training is time consuming. Definitely it cannot be happening in one sitting. You have to take a lot of sessions of training and live demonstrations how to use it. Okay, only on demonstrations we can identify the errors what they are committing and we can correct it. Lack of usability. You have installed the software, there are systems in place, but if you are not going to use, what will happen? The software will be ending in a year. Okay, but you have not used it at all. It is a waste, isn't it? Waste of money. So lack of usability. So whatever to be used, for example, if you have to raise a request, means you have to raise a request only through it. But how did we overcome this challenge? We made it that only if you request through the HIMS, we will process the blood sample. So such systems when you make in place, automatically this challenge can be overcome. Data privacy, this is also a challenge. As I told you, if I'm very clear and I'm ethical person, where I'm the ownership of my password, definitely I'll not give it to anybody else. Okay, so that problem was there. Now in our hospital, actually interns were given the privilege to view the reports and everything, but once they were certain sort of data privacy was not maintained, the privilege of them is taken back, and all the privileges are given to the nurses and the consultants. Okay, so that way we has to be constantly monitored. Then and there audit has to happen, like in this patient how many drugs they have raised, how many numbers they are, like this is all very easy to do an audit through the electronic health record. So that audit we were able to find out that they have misused their privilege, so certain disciplinary actions were taken. So that also is possible. Data migration from this, so the whole data can be techno savvy people can migrate the full data and give it to somebody else. That also can happen. So that system should be under security. All the control systems, okay, control system of all this HIMS software will be maintained in the IT department. That should be secure and under control. Okay, with CCTV camera surveillance should be there. Nobody can enter that room to migrate, do the data migration. Then limitation of technical resource. I told you, limitation of technical, you should be having IT technical people, all three shifts to sort out your problems. And also the systems, everything I told you, number of lab, computer system, keyboards, all these things, drives, everything, there's a limitation. So that has to, that's one challenge. Interoperability. What is interoperability? Sitting in the center of the critical care unit, I can get the opinion of all the doctors sitting in the center of the nurse station, where all the systems are connected to each and every department across the hospital. That is again one thing where one person can, in an officer can view the full data of the hospital. Data means information of the hospital patients. Okay, lack of proper planning. Yes, if you're not going to plan properly, that becomes again a challenge to implement this. Lack of communication. We communicate everything to system. What will happen is, since the report is already there, before what we were doing when it was a paper type of file, we used to call the doctor, tell this is there, this is there. Okay, but now what, there's a tendency that the nurses or the doctors in one team may not report, tell that this patient's blood value was this. Doctor, have you seen it? What to be done? Like that, they may not communicate. What they may think, see, it is already in the system, why didn't you see it? So thereby we lose some communication. Okay, but that also can be rectified provided we maintain a thing called as critical lab alert intimation register, where any such values, means both the nurse and the duty doctor has to, and the lab person will inform the duty consultant that this patient's values are high. Okay, after that they take the corrective action as per the NABH norms. So that way this communication also can be improved. But there is lot of lack of communication, assuming that they would have seen, that is there, but before it was not there, this will be there. So for cost of implementation, it's an expense which I've already explained to you. There's a lot of capital budget and investment, which we have to do it. Staff resistance, we also had this resistance, which I've already told you. Some staffs lacks awareness of the current technology. They will feel, especially some senior people who may not have been used to the routines of the system, may all have the resistance. Okay, so it will cause a delay, but we can overcome it with the continuous training and also telling them the benefits of electronic health records. Training, I told you, it cannot happen within a day. It will take a month together to make them understand, to give them training, to give them demonstrate the thing and how they have to adjust their work accordingly. And it's a big time-consuming process. It's not only nurses to be trained. We have to train the lab personnel. We have to train the housekeeping personnel. Why housekeeping personnel? Even some ward is not cleaned properly, a nurse can raise an issue in the system telling that housekeeping cleaning not done in this ward. So that will be automatically seen by the housekeeping manager, or what he can do is immediately he will ask the person why it is not done, or if you want the attender for shifting the patient, they can raise that in the system that we need a shifting attender urgently. So that also the manager will be able to see and he can send the attender. So that way it is very easy. So everybody has to be trained, so which is time consuming. Lack of usability, I've told you. Sometimes we may not try to adapt. For example, I told you housekeeping, we can do it through HIMS. Okay, this hospital information, electronic health record system, we can give an issue entry. But if you feel that why at all I have to do this, I only make a call, means what will happen automatically, I'm not going to use it. So that shouldn't happen. So that is one challenge where we have to tell the users like nurses, doctors, housekeeping personnel, pharmacists, everything. This is how it's going to help you in your work productivity. Data privacy, yes, they can risk of data leakage. I told you, cyber attack. So for this, what you can do is you have to keep your document controls room very confidential, and that has to be put with a full security with a surveillance camera such that the entry can be limited. Only with a certain passcode the room can be entered. Data migration, have told you already. Limitation of technical resources, yes. Interoperability, again in the next session I'll be taking that what is that interoperability still more clearly. But a patient's complete health record can be transferred to any other part of the hospital. Okay, and sometimes this lack of interoperability can hinder care coordination. Okay, but still at the same time it is also important. At the same time, it's also a challenge. Lack of proper planning. I've told you, if you're not going to execute your plan and change the organizational culture. What is organizational culture? Everybody in the hospital will use only HIMS. Is a culture change what you have to bring among the people in the organization. If there are no proper planning is there, then automatically the culture will not change. Everybody will be sticking on only to a paper health record. Lack of communication, yes, because we have the tool here, sometimes we forget to communicate properly. Okay, so that should be done. Okay, and also we should, if any issues, the vendor also should be able to see that this problem is rectified. For example, if the malware attack, how the malware attack can be prevented, that also should be communicated properly when they are implementing this electronic health record system in the hospital. I've told you already how to overcome the challenges. Just I put up a point, says have a strategic plan. It helps in aiding clinical. You have to tell the doctors electronic health record, nurses also helps in clinical research. It improves the productivity. All this has to be given as an input to the nurses and the doctors and the people using. It ensures strong leadership. How come it ensures strong leadership? A leader can instill the importance of electronic health record into their team members and make it efficient. And also the leader can tell that it's very good for minimizing the errors. Okay, ensuring improved patient experience. Ensure ample training. You have to give adequate training for them, because continuous training only will create this culture change. And work with experts. Take the technical help always, and until you're confident that you can handle the electronic health record on your own. So any doubts with the first part of the title? Okay, anyway, I'll wait for we'll have the question session at the last. So next is the latest global development and standards to enable lifelong electronic health records to be integrated from this. It's very simple to understand what it is. What are the trends in electronic health records now? Okay, and how are we going to use into the hospital system completely integrated into our practice? I can take it as a nursing practice. Okay, we saw what is electronic health records. Next we'll see what is the trends in the electronic health records in the patient nursing practice. I told you HIMS, hospital information management system. So this is what we have started into the nursing practice, starting from the patient data, where all we are going to use this laboratory investigation reports, radiological investigation reports, paperless requests, indenting medication, blood requests, everything goes through this electronic system. Okay, this is for the students over here. I was telling about the system. This is our gynecology ward. You can see the nurse in the nurses station opening up the system. You can see small boxes. So each box is one patient's bed. Okay, there the patient's name is there. If the patient is in bed, there you will get patient name and the details. If not, you will get that there a smiley which tells that patient is not there. It is a unoccupied bed. So this dashboard, this is called as a dashboard. In this dashboard, you can see almost 6. So 24 patients data is there. So first, this is opening up of the dashboard where you see whether patient is in bed or not. A patient bystander EMS is telling, my father's name is John, he is admitted, I don't know where he is. The nurse from there can open up, type the name John, find out which ward, they can tell you which ward the patient is located. Okay, so here this shows that how much beds are occupied, how much beds are left unoccupied. So from the EMS, if you want, you can receive more patients, though this is the patient data. So when you click on to this one box where, for example, patient John is there now, you click that one box, then the patient's profile will be open. Okay, in that patient's profile, you can get all the basic details of the patient, his name, sex, his UHID, what is the universal hospital identification number will be there, and okay, the date of admission and under which unit he is admitted, who is his treating doctor. Okay, all this will be the basic information provided in the first sheet. So this is what this is what I told you. And from here, so all the smileys shows that the patient is in bed. You can see below Dr. Shiva Ranganathan Green, it is under this unit, it is being admitted. Okay, so it is under bed number 3. FMW stands for female medical ward. This IP number is there. Okay, wherever patient is not there, you can see a smiley. Usually it will be red or it can be in blue color. Here it is in blue color. So you can have it like this. These all beds are vacant. Okay. For example, if you want to know, EMS nurse wants to know whether beds are available in gynecology ward because they are having a patient. If they open up this H1 ward, check the status, they can find from their own area that 3 beds are vacant, so they can send patients there. Okay. So on the top, you have reports, you have tools, you have OT, store act, request. I think you're able to see what I'm telling. Request issues, MRDK sheet, CSSD, MR. So what is all these things is reports. If you want to see any patient's reports, if you click onto the reports, there you can get, or you type the patient's name, you can get the patient's report. If you want, what is the surgical list? Okay, what are the patients posted for surgery tomorrow? If you open up OT, there you can find the surgical list. Store act, you want to get some item from the store for this ward. You request, you can get that also. So a transaction, see in this you have ward discharge, specimen collection for lab, specimen collection ward, vital signs, doctor and nursing notes, billing, everything is feeded into it. So when you go and click everything, you can get service billing. If you have any IP inquiry, how many patients are there, whether this patient is there in this hospital or not is an IP inquiry. Okay, IP discharge, you want to know the discharge status of the patient, how many patients they get in there, you can see in the IP discharge. Okay, so this is about, and you wanted to shift one patient from one ward to another. Through this HIMS itself, we can transfer a patient and this name will be transferred into another ward. Okay, on the top you can see there is a ward given as obstetrics ward. So that is the way, if you click the ward there, you can find out which ward the patient is being transferred. This is for specimen collection. Specimen collection is here you have the bill number, bill date, request number, IP or OP is there, registration number, patient name Revati, which doctor is requesting the sample and requested by. For that again you have generate one number, what is the diagnosis, okay, and which sample you are sending. That also in the on the top of the dashboard you can see the from date, request number, name, bill number, IP, everything you feed in, it will be coming up like this. Once the report is ready, you can give up, you can view the report also, and you can get that report also seen in the system. So lab orders, whatever was raised, okay, on 6th, 5th, 5th, you can see the dates, okay, how many requests you have given, complete hemogram, okay, who has given the request, whether it's completed. You can see on the other side in process. That means you have sent the lab sample for culture sensitivity, still the report is not updated, the process is pending. Okay, that shows us in process. So the nurse can view from there, doctors can view itself whether the reports are ready or not. Okay, and similarly you can send it on the top. You see consultation, CSSD, diet order, lab order, radiology. If you are sending any investigation, any medicines, any stores you want, everything can be viewed here. This is how you can see the lab request. Okay, this investigation report, sometimes what will happen, they can send it through SMS also. So this, for example, the patient is coming to OPD, given the sample and went home. He wanted to see what happened to his report. This report will be sent through an SMS. So that SMS he can view it for 5 days. After 5 days it will go off. Okay, and if they want a paper copy, when they come and request, they can get a paper report. Otherwise this can be saved in their phone later after within the 5 days. So this is how you see. You can see that red color which shows that hemoglobin is low. Okay, PCV value is less than the normal limits. Okay, RDV, CV value is less than the normal limit. So this all comes in red color. So automatically you will get an alert. Yes, so this has to be intimated to the doctor. The doctor also, okay, hemoglobin is less, this is less, so we have to do the corrective action. This is how a patient's report will be viewed in the system. So I told you that red color. Sometimes what will happen, we have a system where that red color means what will happen is that lab personnel will send that critical lab alert SMS will be sent to the doctor, and a call will be given to the in-charge nurse that for this patient, whomever you have sent, there is a critical lab, hemoglobin is only 8.9. So automatically the nurse also will talk to the consultant also will cross-check and come and do the treatment and coordinate with the nurse telling that please follow this treatment. So this is a critical lab alert message. This will be sent as an SMS also to the doctor. Okay, this is a radiological investigations and other investigations. Okay, they have sent a biopsy large sample. Okay, they have given the order date on 6/9/2023. At this minute they have sent it. Why this is very much easy, no? Because when you send a sample for a blood investigation, you can see here the third one, urea blood 24 milligrams. 6/9 they have sent it at 12/25 order date. Okay, here there is one more place where you can see when the sample report was updated. Okay, this is what we call it as turnaround time. So from the time the blood sample is ordered, when the report is generated, that's very much important for a clinical decision. So that also can be calculated by this itself. Okay, so through this itself we can see. So this helps in that also. So liver function test, when it is done, it's completed. Sometimes if received pending means the sample is not yet reached the area. That's why they kept it as pending. Okay, so that also is available. This is picture archiving communication system, PACS integrated with HIM. What is this PACS is? You have taken an X-ray. Okay, this X-ray I told you within 50 kilometers radius. If the doctor is at home, maybe night a patient came to an emergency, was taken, this he can view through PACS and give his opinion. Okay, orthopedic senior professor is at home within 50 kilometers, so it will be accessible. So they can do it. And now there are softwares to extend this accessibility also. Beyond 50 kilometers also they can get connected through this, only for this sorts of investigation reports, etc. So that from there itself they can tell the duty doctor here that yes, this X-ray is there, this is the diagnosis, you can go ahead with the emergency surgery or you can wait for till morning. All these things can happen. This is called as PACS integrated with HIMS, that is picture archiving communication system. So what is this is, if you go to the X-ray, you need not see give the film and see the X-ray. Okay. So the radiology will put this report into the PACS. The doctor in his office can open this PACS and see, or at home also he can open and see at emergency hours. Okay, he can go. So the patient need not wait for the film to dry and then get the film, go. The patient has to go to the radiology department, get the film, give it to the doctor, and then the doctor has to view. Okay, so immediately they can see in the system also. But films also are provided for legal purpose, but they can see in the system. So it time saving for the physician. Here I told you formulary will be already filled in. Okay, this is how they do the medications. The patient's name is there, which doctor, everything, and here pay pharmacy or free pharmacy is there. They can mention the medicine here and give, and that medicine order will be seen by the pharmacist. And here you can see medicine, drug frequency, dose, unit, which unit, how many days, dispensing quantity, amount, etc. So everything is put up properly. Nowhere error can happen here. Blood request. Okay, they have sent a blood request. This is for, we use a backbone software. So here transfer where you have sent the blood, which ward, neurotrauma ward. Okay, admission date, blood group not assigned for this patient. Okay, if you have a request, you can write blood group requested. So request is there, but they have not dispensed the blood sample. Okay, blood bag. That only blood group not assigned. So the request is there, but the patient has to go, the nurse has to go and get the blood bag and come and administer for the patient. That is the status over here. What is interoperability? This is all the trend now. You can see everything is operated through the HIMS. What is interoperability? Reference degree, which is software system device. What I told you, PACS is an interoperability. Okay. So in the radiology department, the person will feed the report in the PACS. The person, pulmonologist sitting in the second floor, can see the X-ray report in the system itself. Okay, that's again interconnected. Okay, so they can access to the data. Okay, cross-organizational collaboration. Sometimes what happens, this PACS can be collaborate even with their other sister concern hospital or other hospitals outside also. They can maintain this interoperability. But our organization is operating only within our hospital. We are not doing it to the other hospitals. You can see this is a critical care unit where the interoperability system is maintained in between. Okay, this is only one part of the critical care medicine. So surrounding these blocks, we have medical intensive care unit, CTVS ICU is there, neuro ICU, this is only one part of your ICU. Around this block, again, there is a full circle of all the ICU situated, all 7-bed, 10-bed ICU situated around this block alone. But we can, through this monitor here, they can access all the patients' data which are available outside this block. I told you 5-6 blocks are there, no? Medical intensive care unit, cardiothoracic care unit, like that. Everything they can access. Okay, that is called as interoperability. Ability of different information systems, device, applications to access, exchange, integrate, and utilize patient data. So from here they can access and they can also integrate it. Okay. This is another trend which is there, which is doing good also. Two of the same electronic health record system exchanging patient information between two different doctors' office. I think you are able to understand what I am telling. A doctor in critical care unit can share this data. Probably he wants to get an opinion from a pulmonologist because the patient is having a respiratory failure, or maybe patient is having a pneumonia he wants to get. So he can share the information from here, tell the pulmonologist to see the PACS, the X-ray of the patient, or see the reports of the patient in his office and give the opinion. Okay, so same electronic health record systems can be exchanged. That is called as interoperability. Okay. And similarly, from there he can prescribe, and that can be incorporated through EHR, and the dosage of medication is programmed in an infusion pump based on the pulmonologist opinion. So it all takes some few minutes to have a clinical decision, set up the equipment and start the therapy. So again here I forgot the last line. Interoperable system eliminate manual entry and calibration. Everything, how much dosage to be given, how it has to be done will be given in the doctor's order from the pulmonologist intensivist. that will come through HIMS, and that only nurse can follow. So nowhere the nurse has to tell, I calibrated it wrongly, I calculated wrongly, there was more amount of medicine get got, because already it is documented, evidence is there that doctors order only so much to give this. That's why she has administered. We can appreciate how far this technology has helped the nurses to stand for their thing, telling that there is no administration error, because whatever order they have given only have administered. Otherwise, in paper works and all, no, every minute to minute nurse has to record to see that her duty is documented properly. But here it's already automated. So to conclude, though it's a big paragraph here, I'll tell you in a nutshell what it is. We are all going for a patient-centered focus and to provide a very good quality care. Okay, but the people who are involved in this are the healthcare team, and predominantly the nurses are the most frontliners in all this healthcare delivery. Okay, so this electronic health record helps us to reduce our workload of writing documents, documentation, written documentation. It becomes automated, electronic document. Okay, and it's very accurate and timely. It is happening, and also it's a continued commitment to provide valuable health information. This health records can be transferred to any other thing also, any other organization also, for cross-reference for the patient. A patient who's done angiogram here wants to get an opinion from some other CTV surgeon outside the state. You can transfer the angiogram report through the electronic health record system, and you can get the opinion there and facilitate the patient. Okay, and the paper cost is minimized. Because of this good system in place, many patients will come inside, so the revenue of the healthcare also is increasing. And above all, your manpower resources are limited now. Okay, so that helps in that all. Otherwise, in a place of 4 or 5 nurses, you can have 3 nurses, because your writing work is minimal. Because most of the complaint of the nurses and the doctors is nurses spending more time in writing, so that is minimized. Okay, so this electronic health record helps in that. Thereby it also helps in revenue generation, so the patient satisfaction is very good. Okay, and also up to date information is there, the data is very reliable. And now nursing practice is not only confined to practice, we are in education also. Next thing what we are looking is research. This electronic health record has given it's like a boon for our research, clinical research. So we have ample data stored in the document, which we can retrieve at any time and use it for our research purpose to improve the quality of patient care, to get the statistics, etc. So this is the thing, like if we integrate into the hospital, this much benefits are there. This is what is the trends which is existing in the electronic health record, and how are we going to integrate, starting from the admission till the investigations, till the patient treatment. And we are also trying to incorporate nursing process document also into the electronic health record. You need not maintain the care plan. Already a developed care plan is there, only you have to give a tick in that. For example, patient comes with pain, comfortable device is provided, you give that will be already there in the system. You have to choose a nursing diagnosis pain, okay, for which interventions follow up. You only have to tick the intervention which was applicable for your patient. Your nursing process is done. Okay, so that way it is going to help you a lot. And also there are data driven benefits and enabling healthcare organization to transform a lot of data into a small system, and thereby the cost containment is there. And also for the medical records collecting data system has improved. So this is what is the importance of electronic health records. And for the nurses, again, this is doing a boom where you can spend more time by the patient's bedside instead of wasting lot of time compiling here lots of records for the patient. Okay, and you know, now the legal stands are also very more consumerism is very high. Each and every act of yours, the person or the patients can put you into court. So when you have electronic health record, it's already accurate and everything is recorded there. So you are also legally safeguarded, right? So your paperwork is minimized, and in your search of papers, already everything is documented and stored. Even after 10 years you come, the data will be there in the hospital in the electronic health record. But whereas in the paper type, after 10 years, you know, the handwriting becomes vague, the records becomes old, Okay, then there's you have to follow certain systems to destroy the records. All these things are there. But electronic records are not like that. You can keep it for many more years. So that is also there. These are the added benefits of having an electronic health record, and this is how the trends are evolving now, and many more evolvement is going. As I told, nursing process. Many hospitals have adopted nursing process. We are yet to do it. Nursing process also can be incorporated into the electronic health record. The nursing notes also can be incorporated into it. Okay, so all this when comes, what happens is your time management is very good, and you go to the patient side, you care for the patient, you talk to the patient, you touch the patient, and do all the care necessary which the patient also is wanting for. Okay, to conclude, you might be surprised to know how many pieces of paper your hospital chart may still contain. Okay, so we should be all aware, even alarmed about all the gaps and critical information that may exist in any patient's computerized records. Okay, so this all these gaps which was present in the paper, we are able to fill up during using a computerized record, but still there will be some gaps which we need to fill it in the years to come. I'm not telling electronic health records all the good well now. Yes, there are some flaws into it, but still that also will be rectified in the years to come as we start practicing this electronic health records. So that is about the trends in electronic health records and how are we going to integrate with disparate system. So we have integrated in our hospital completely, but still some of the nursing things has to be still more integrated. We are working at it. So nurses need to keep themselves updated in health informatics too to help establish themselves empowered and quality nurse. And this electronic health records will help you to take care, and the updation in electronic health informatics will help you to take up the electronic health record system and improve the total quality management, because it is not, it's a journey, not, it's not an end, it's a journey. Again also we have to keep improving upon ourselves to improve the quality of nursing care. Okay, we have to learn all of our lives, as Florence Nightingale said. So this doesn't end with this. Maybe another 5 years there will be something else coming up, evolving. We are supposed to get updated even in that too. So that is the way we take ourselves as nurses. Thank you for this opportunity. If you have any questions, I can answer.
Thank you so much, ma'am, for your elaborative session. It was really interesting, and you all have updated with your HIMS system. That definitely will help the students to understand. And I ask students, if you have any doubts, kindly unmute the system and ask.
Was it useful to you? Okay. Actually, I tried to get some online operations also, but it was a little bit difficult for me because I was not able to take that securely the data out. That's the problem.
It's okay, ma'am. At least they got an orientation about the topic. It is definitely it will be useful for them. किसी को कोई डाउट है स्टूडेंट्स इफ यू आस्क सबको समझ में आ गया only language is a barrier man but still they can understand English, they can write. Only in speaking little bit difficult because many of them are from Hindi medium, no?
Okay.
But they can understand. They are good students actually, so they understand everything.
Okay, probably this notes I can circulate to you.
Yeah, sure. Okay, thank you so much, ma'am.
Thank you for your patient listening.
Yes.
If you have any doubts, you can put it across to sir, and I'll try to help you out. Okay. All the best. Thank you.
Thank you so much, ma'am. Thank you.